Awesome.
You might need to speak up a little bit, but I'm gonna get my side if that makes it better.
Okay, hopefully everybody can hear me because I'm like sitting on the microphone. So on your blueprint, well, there's your postpartum assessment. Remember we talked about the specific things that we assess for our clients postpartum, from right after delivery through their whole hospital stay, and sometimes even after they go home if they have complications. So what's the postpartum assessment look like? Then you have your complications. We talked about some big ones. You know, there's some infectious things that go on. What's another big thing for
This
postpartum?
is Chester, this is Jeremy and Tonkawa. We're having a really hard time understanding you.
I'm gonna take my mask off. Is that better?
Yeah, that's a little better.
Okay, so we were just talking about, you know, postpartum assessment, what we look at, what we watch for. And then our complications, we talked about some infectious processes, right? The different things that are pretty common in postpartum or that you can see. We talked about another big complication. What was that?
Hemorrhage.
Hemorrhage. That's the one thing we're really focused on, right? Is our hemorrhage situation. That's why we do what we do regularly, right? There's two questions, postpartum nutrition and breastfeeding. So one of them is probably related to nutrition and one of them is related to breastfeeding. So know a little bit about those things. And then I will probably have maybe some pharmacology. You know, I talked about specific medications that we give maybe routinely or to treat certain things. So know those medications, what they're for, how you know if they're working. And then there may be some delegation and prioritization, you know, on your patients. Who do you see first? Or what would you do first? Or things like that. So know what you can delegate, know what's priority, just like your ABCs and everything else. Know what, you know, you would need to do first or who you would need to see first. All those kind of things that are usually on most of the tests, right? So that's pretty much all I have. So any questions?
I think you did have a question on the discussion board. I saw that this morning, Ms. Chester. I don't know if you got to it or not.
I answered one already today, but if I have another one, I'll look
Maybe,
here.
I just pulled it at the beginning, so I don't know.
Okay, well, I think I addressed it, but I will look again. I think some people were asking a lot about ovulation and contraception and stuff like that. Don't go into big detail about that. Just know that, you know, breastfeeding is not good birth control, even though the ovulation is suppressed while they're breastfeeding, you know. Just basically in your teaching, you need to teach your clients to be on alert. What am I going to use for birth control? Because that, you know, subject will eventually come up and they need to be prepared. So you don't need to know all those details. So, okay. Any other questions?
We have one thing here in Stillwater.
Okay.
Mastitis, you hear me?
Yes, I can.
So you said that when they're breastfeeding, they should start with the affected nipple? The affected one?
Yes, because remember that's a blockage, and so we want that breast to empty. So, you know, usually the first breast that the infant feeds from, they're more vigorous, right? Because they're hungry. So, did you see something contrary to that, or?
Yeah, in the book it said to start with the unaffected side.
That is, yeah, I don't know. That is kind of weird, but I don't think that's gonna come up on the test, but, you know, just recognize that it is a blockage and that, you know, you shouldn't totally stop or whatever, but it just kind of depends on the situation. It's one of those things that depends on the provider, the patient, you know, whether they have an abscess, whether it's just the mastitis, things like that.
Okay,
You're welcome. Anything else? I will be out of town, so if you do put a question on the discussion board, you might text me or something if you have my number. But I'll try to check it frequently, just to make sure there's no last minute questions or whatever, so. That's all for me.
Everybody should have my cell phone number because every test I posted my cell phone number with every test. If you have complications, you text me, right? It's on there. You call me, you text me. So everybody has my cell phone number. If you don't, go back to announcements and get my cell phone number and put it in your phone, okay? If you have a question for Ms. Chester, you don't have her number, text me. I have her number. She mad.
Yeah, darn it.
I know, right? Dang it. And don't hesitate, but do keep in mind, this is our weekend too. And we may not address it till the next morning if you're texting me at 1 o'clock in the morning, when I heard earlier that that's good study time for some people. That's good sleeping time for me.
We need a break.
I probably will not answer you till the next morning.
I'm here for you, but.
We're here for you, but we're not gonna. Our time and regular time, right? Awake hours, Saturdays 9 or 10, till 9 or 10. Saturdays and Sundays, I go to church Sunday morning, so, but, don't hesitate to text me and say, hey, there's a question on the discussion board. Again, don't text me your questions, put your questions on the discussion board, but text me if you have a question, okay? I try to be really good, but sometimes life gets in the way and I don't always check as much as I should. And sometimes I get obsessive about it and I check all the time, so you just never know. All right, guys, any questions for me? I really did, at the beginning, talk a lot about make sure that you're reading those nursing interventions, that nursing management portion of every disease process, so that you have an idea of how you're going to help these kids and teach what to teach, what their families, look into chest tubes, look into medications, know the medications that are on the blueprint, and there may be a dosage calculation question, so make sure you know how to do that pounds to kilograms and know what information you need on doing dosage calculation questions. Because with these cardiac medications, a lot of them are pounds, kilograms, maximum dosage in a day, divided doses. Practice some of that, be aware of that, because that's a big deal. And cardiac medications can be deadly. So I expect everybody to get the dosage calculation questions right. Okay? Because they can be deadly, they're toxic, they can cause horrible blood pressure issues, they can put them in the heart block, they can, so many different things that can go wrong. So please make sure you know how to do that. Let's see, what else? No, I treat heart failure, right? Look through your medications, know about diuretics, potassium, how do we get potassium, know your lab values. BNP, and in your newborns, they'll have a little bit of a BNP, but typically, anything over 100 is indicative of heart failure. And your newborn. When you get into your not newborns, usually that BNP drops like next to nothing, like 17 or something like that. But it's still pretty much, and that's that way for adults too. Typically, and there may be a little bit of BNP in the body, but when it starts getting elevated over 100, that's when you have issues. Those of you that know, it's just that way. And the higher that number is, the worse the heart failure is. Some of you know that my best friend's husband passed away with an acute cardiac crisis. We were visiting about BNP the other day. Her husband's BNP was 7,000. 7,000. That's why his heart stopped.
Is it like that for adults too, over 100?
Yes, yes, yeah. So, that's why the severe heart failure and his heart could not keep going. So, so know those lab values, and so that if you can decide to, we're talking about some issues with infection, right? You've got your bacterial enterocolitis and your rheumatoid or rheumatic fever, Those are infected disease processes, which will affect what blood value? White blood cell count, good. So those are some other things you need to know and be familiar with, because that could be an indication that we have an infected process going on, right? Any other questions for me? Yes, ma'am.
So with rheumatic fever, like the diagnosis ages is at 5 to 15.
For rheumatic fever, is the diagnosis age between 5 and 15? That's when it's seen most commonly. Okay?
Is it like a cutoff age?
No, there's no cutoff. I mean, there's really no cutoff age. You don't see adults with it as much. It is typically a childhood thing. But I don't know that recognize that age ranges and things like that are norms. And what are normal values are basically an average of abnormals. When I say 5 to 15, that's a general age range. So you may see it in a 3-year-old, you may see it in a 18-year-old, but on average, it happens in those age ranges.
What's the in-class assignment?
Okay, in-class assignment, so it's that cardiac assignment, and guys, I noticed it wasn't on the calendar. If you go to SurePath, and you look at next week, it says congenital heart disease, and it's due Tuesday at 8 a.m. or 9 a.m., something like that. That's the assignment for this week. I do need, before I forget, thank you, I do need everybody to go in on chat, all of my distance people, go in and type your name on chat, please. Just type your name. So all my Zoomers, go into chat right now and type your name, please. That's how I'm gonna take attendance today. And if somebody's not there, let me know. Stillwater, Tumble, let me know. And we'll go from there, because I tried to do that